Hyperextension injury. The injury is commonly seen in the cervical spine. Examples: motor vehicle accident, the forehead striking against the windscreen, forcing the neck into hyperextensions. Shallow water diving, the head hitting the ground, extending the neck. This is the picture of the hyperextension injury results. This injury results in a cheap fracture of the anterior rim of a vertebra. Sometimes these injuries may be unstable. Flexion distraction injury. This is a recently described spinal injury being recognized in Western countries where use of a seat belt is compulsory while driving a car. Example with the sudden stopping of a car. The upper part of the body is forced forward by inertia, while the lower part is tied to the seat by the seat belt. The flexion force thus generated has a component of distraction with it. It commonly results in a horizontal fracture extending into the posterior elements and involving a part of the body. It is termed a chance fractures. It is an unstable injury. Now we can see in these pictures the chance fracture, direct injury. Direct injury. This is a rare type of spinal injury. Examples: bullet injury, lathi blow hitting the spinous process of the cervical vertebra. Any part of a vertebra may be smashed by a bullet, but a lathi blow generally causes a fracture of the spinous processes only. Violent muscles contractions. This is a rare injury. Example: sudden violent contraction of the psoas results in fractures of the transverse process of multiple lumbar vertebra. It may be associated with a huge retroperitoneal hematoma. Clinical features. Presenting complaints. A patient with a spinal injury may present in the following ways: pain in the back following a severe violence of the spine. The history is often so classic that one can predict the type of injury like to have been sustained. At times, the pain is slight and one may not even suspect a spinal injury. Sometimes a mild compression fracture of a vertebra may occur from a little jerk in the osteoporotic spine of an elderly person. Neurological deficit. Sometimes a patient is brought to the hospital with complaints of inability to move the limbs and loss of sensation mostly. There is a history of a violence to spine immediately preceding the onset of the complaints. Sometimes the paralysis may ensue late or may extended proximally due to traumatic intraspinal hemorrhage. Examination. General examination. A quick general examination should be carried out to evaluate any hypovolemic shock and associated injuries to the head, chest, or abdomen. Neurological examination. It is carried out before examining the spine per se. By doing so, it will be possible to find the expected segment of the vertebra. The level of motor paralysis, loss of sensation, and the absence of reflexes are a guide to the neurological level of injury. It is easy to calculate the expected vertebral level from the neurological level.